So I work as an oncologist looking after women with ovarian cancer, and the problems are the complexity, almost at every level. Firstly, the wiring diagram of the cancer is very complex. Secondly, almost all patients have advanced disease, so they have multiple areas of disease that are different and respond differently. And then lastly, as a combination of that, we are still struggling to find targeted or precision treatment for those patients. So I think the biggest advances will come from use of AI and machine learning and other computational approaches to reduce that complexity. So we've started by trying to take this very complex genome, the wiring diagram, and working out patterns so we can see the trees instead of the wood. Secondly, we need to take standard measurements that we take on patients with CT scans and turn them into quantitative measures. So instead of saying, well, this patient looks a bit like this one, we can actually quantitate that. And lastly, I think that if we're really going to move the needle for patients, we need to bring up the quality of care. And that's about providing additional diagnostic help and decision advice. So of course I spend my time looking at these complex genomic patterns, but how does the oncologist somewhere else in the country perhaps not know those so well? So I think machine learning will actually help in the identification for patients for trials and with recommendations that will help doctors make better decisions and help recruit patients to trials. One other challenge I didn't mention for ovarian cancer is it's relatively rare. And that means we need to come together, we need to bring people from different disciplines and learn from other disciplines. So meetings like this are critical. It's about an interaction of ideas. It's about being able to sit in a seminar and go, wow, we hadn't thought of that. What can breast cancer teach us? What can glioblastoma, brain tumors tell us? So I think these interactions, these sharing of ideas are really, really important.